Hi, everybody, and welcome to the World Malaria Day event. As you all know, we have been preparing this event with many different professionals worldwide, and we will be introducing them shortly. And I hope you enjoy. As you all know, malaria is a disease that it's affecting millions of people worldwide. That's why it's important to have one day where we remember and we are aware and we put together all these brilliant minds that help us fighting against this disease. I will start introducing myself. So I'm Eduardo. I'm the lead and head of AiScope, and which is basically an NGO that tries to create a diagnosis device that is smart, open source, and really, really cheap. And you can bring it anywhere, and you can diagnose people of malaria and other diseases just by putting a drop of blood and letting the cell phone do the whole diagnosis. We have together with us some really interesting people. So, for example, we could start with Laura and Ramon. We have them here. Ramon, who is muted, and Laura is also muted. Hi, how are you guys?
Hi, good morning,
Good
everybody.
morning.
So, actually, the whole project of AI Scope started with them. So, in a really serendipity way, I met Ramon and he invited me to go to Ethiopia, and where I met also Laura, and where actually the whole project of AI Scope started. So, yeah, I couldn't be here without you too. So, guys, do you want to maybe introduce yourself a bit?
Thank you, Eduardo. I think you say this
Thank you.
because you are a good friend of us. I think we actually met in Peru a few years ago, and you always explain your project of your microscope, which make us just proud of having met you. So, I myself, I work in infectious disease. I'm a physician, and my whole time, I spend most of my time seeing HIV patients. But both of us, Ramon and me, run a tropical a master in tropical medicine and infectious disease in international health, which takes place also in Ethiopia and Peru and Kenya and Cameroon, and we try to help in malaria diagnosis as well. And then Ramon is a microbiologist.
Um, yes, I'm Ramón Pérez Tanoira, clinical microbiologist in the Hospital Universitario Príncipe de Asturias in Alcalá de Henares. And yes, and with Laura, we are coordinating the Master of Tropical Medicine and International Health. We perform some malaria studies in countries like Peru and Ethiopia, also now in Cameroon, where this disease is still a big problem, and we try to improve the diagnosis with different tools, and one of these tools is your system, your software with AiScope. I think that is a very good possibility for the future.
Yeah, I mean, if I'm not wrong, you have been also testing on the field new techniques, like it was called a LAMP technique. Am I right? What is it about?
About the techniques for the diagnosis of malaria.
Yeah, exactly. The LAMP is the one called LAMP, right?
Sorry, could you repeat?
Yes, I think he's asking about LAMP.
Exactly.
And you actually, you,
LAMP. Yes, the LAMP is sorry. The LAMP is a new technique of PCR. Is the sensitive of this technique is very good. Is comparable to other molecular tools. It's a very good option for rural laboratories because they don't need a very complicated machines. The only problem is that it's a little bit expensive in this moment. But it's a very good technique for rural areas where the malaria is a real problem. We have some experience with this technique in Ethiopia, and we got a good results there. But the diagnosis of malaria is still based in microscopy, and for that reason, I think that your software and your technique is a very good alternative for these rural areas.
And now that you said Ethiopia, so like for the people that don't know Laura and Ramon, and as Laura said before, they lead this Master of Tropical Diseases in Madrid. And one of the visits that they do is in Ethiopia, in Gambo. And maybe we have Iñaki later, if he can manage to join. Let's
Nice.
see. Let's see.
Good.
He's also a really nice guy that we met along the way. Good. So thank you very much. I will keep adding people to the conversation. So then after, actually, I could even like have the flow here of the how AiScope was being developed because it's how I've been getting to know all of you. So the next person then to join will be Rachel. So thanks to going with Ramon to Peru, I was able to go to present for the project for AI scope in ASTMH in New Orleans. And then there I met Daniel Bridges, who was the former boss of Rachel. Here we have Rachel. Hi, Rachel. How are you?
Hi, everyone.
Rachel has also been helping the project and also is a professional of malaria since many years, right? Could you explain us a bit about you? What do you do and what is your role in the National Malaria Elimination Center?
Okay, so my name is Rachel Casaro, and I am based at the National Malaria Elimination Center, which is the research center. I am a laboratory scientist, and my main role is working on samples that we collect from around the country, which we check for parasite prevalence, which the government uses to come up with informed policies for the control of malaria in our country. So that's the main thing I do. And then I was working with Eduardo, I think maybe 2 years has passed, right? So
Three
for the
years.
past, yeah, I think about 3. So my role has been the collection of images that we are using to train the AiScope to be able to be used in identification of the parasites. Yeah. So
Nice.
I think that at the end of the day, this app will be very useful to us because being a research center, all the slides for the parasites that we check come from the different areas. So if the parasite identification can be done in the rural areas before it comes to the center, that can be an easier process and anyone can do the work without much training.
Yeah, that's great, but also I wanna put some emphasis into like you have been helping the project since the almost the very beginning and putting a lot of effort. It could not be as it is without you. But also, Zambia has a really ambitious project regarding malaria. So if I'm not wrong, the goal, I don't know if it changed because of COVID, but before when I was there, the goal was the total elimination of malaria of the country in, for which year was it?
2022, this is the year.
Okay, yeah, maybe a bit tight. How is it going?
Okay, so different strategies have been rolled out for the country. So we have areas like Southern Province, which have a very low prevalence of malaria because they were rolling out what is called as a mass drug administration and also the distribution of insecticide treated nets and indoor residual spray. So for that area, the malaria has gone down dramatically, but we still have different areas such as the northern province, Luapula, which still have high prevalence. So the strategies will be moved to the different areas to be able to control the parasites.
Nice. And how has been the evolution? I mean, I can imagine that it has been going down since the last years, but was there like a moment, like how to say, like some kind of action or decision that started making dropping the number of cases of malaria in the country?
Do you mind repeating the question?
Yeah. So was there in the last year, because I'm pretty sure that like, the number of cases of malaria has been dropping in the last years for
Yes.
significantly. And was there like something that led to this drop of cases?
Yes, so the interventions that they are using, the insecticide-treated nets, and also the indoor spraying is helping to bring down the numbers. Yeah.
Okay, nice. And also, you have been collaborating in a research about using nanopores minions, right? To
Yes.
the malaria. So could you explain a bit more about this? Because honestly, I have no idea, and I'm really interested.
Okay, so the nanopore is a tool that was developed by Oxford, and here at our lab, it was mainly used in the COVID research. Yes, so the lab got involved in COVID work, and then now we have decided that we can use it in malaria research for sequencing. So currently, we are coming up with the protocols that will be used to test for the malaria sequences. That is still in the process. So, but then that is what we are working on.
Nice. It's cool. I'm happy to see also, because like people should visit your lab. You have a really interesting lab there, and it's really interesting to see how you're doing this kind of cool projects, and yep, again, going towards the future, which is what we all should do, and what I think we all do. Cool. So then, if we keep going into this evolution of AiScope, as I said, like we went to ASTMH, and randomly there, I met a really good friend of mine now on the plane who introduced me to Pedro Berzosa and Gemata. Let's add them here as well. We have Pedro and we have Gema. Hi, guys.
Hello, everybody.
Hi,
Good
everyone.
morning.
So you maybe can introduce yourself a bit better, but you two work in the Carlos III Lab of Tropical Diseases. Like the problem introducing all those people today is that you all do so many things that it's really difficult for me to remember everything. Like the amount of different things that you do is just incredible. So it's better that you do it yourself and you introduce it yourself.
Okay. Can I start, Gemma?
Yes, you first, Pedro.
Okay, thank you. Well, my name is Pedro. I'm in charge of the Laboratory of Malarian Entities of the National Tropical Medicine in Carlos III. Our lab is working in technical cooperation in endemic countries of malaria. Normally, we support different national programs of malaria, mainly in Equatorial Guinea, where we are working with the program in resistance to different anti-malarial drugs, prevalence of malaria, quality control of the diagnosis, and different aspects as HRP2 and the false negative in RDTs. And now we are starting to work with different countries in Africa, as Nigeria and Burkina Faso.
Nice. Never stopping.
No.
And Gemma, let me say a tiny word of you. Gemma also has been helping a lot the project. So like if you if you can send an email and expect an answer quick, it's going to be Gemma the first, always. So I could also not be happier to have you here. And also, maybe let me do a quick introduction of what we are doing in AiScope so you can continue there. Okay, so basically, in AiScope, we try to build this AI that will diagnose diseases just by putting a cell phone on a microscope, and it will already be able to say, hey, there's a parasite, you should visit a doctor because you most likely have malaria. To do so, like AI works like the brain of a child, like an infant who has no idea of anything. You need to be training this. It's actually called training. So you show this brain pictures and you say, okay, that's a parasite, that's not, or that's a dog, or that's a cat, that's a dog, that's a cat. Slowly, it keeps learning how to find a dogs or cats, and that's how it works. But to do so, you need what is called the dataset, which is the core part of any AI project, and it's the most expensive, most difficult, most time-consuming, most laborious, and the AI software will be as good as the dataset. So that's where maybe Gemma, you can explain how works your work. Same as Rachel also has been helping, and other people has been helping the project. But I think it could be interesting for people to see that.
Okay, firstly, I'm going to introduce myself. I'm working with Pedro in the same laboratory, the laboratory of the National Center of Tropical Medicine in the Instituto de Salud Carlos III. I recently incorporate in this laboratory. This is my 4th year working with Pedro. Although my main field is filariasis, I'm very happy to help Eduardo to collect the images of malaria for the AiScope application, because I think we need this kind of app to make easier the diagnosis of malaria, because in my opinion, to diagnose malaria is one of the most difficult parasites to diagnose by microscopy, in my opinion. I'm actually working in filarias, and comparing to diagnose of malaria, for me is easier to diagnose filaria than malaria. For me, I'm very happy to help Eduardo to collecting these images, because it can help both students or researchers to make the diagnosis. And what else? For me, the application is very easy to use.
If you like, Gemma, I have here the video that you recorded actually of the application, and you can explain how it works.
Okay, first you have to install the application in your mobile, and open the application, and you need to an adapter, no? You say, how do you say, Eduardo? Adapter.
Exactly.
To fix the mobile in the objective of your microscope. So when you have the mobile fixed in your microscope, you look for the field and to check if you have the malaria parasite. And once you have a field with malaria parasite, with the 100x objective, with the oil immersion oil, you capture the images. When you capture the images, you have several buttons, 4 buttons in the application. The pencil button. You say this pencil, or the
like the brush
with this button you can increase the image when to see better the parasites. And with the pencil button, you point out the parasite, and but you have to choose first the stage of the malaria parasite, because we have 4 stages for the malaria parasite. And in this case, in this video, the states of the malaria parasites are trophozoites. So you point out the trophozoite, all the trophozoite that you can see, and once you finish to point out all the malaria parasite, you click in done button. If you would like to see more field of the microscope, you can add the images. If not, if you don't want to see more fields of the microscope, you save the image.
Perfect. Thank you very much. It was. I'm sorry that we didn't prepare this part, but as you joined last second, I thought that as you have been working also a lot with this, it would be interesting that you show how it goes. Let me show also that I prepared something super quick while you were talking about, so people can see and can understand what the adapter is. So here we have the microscope, the cell phone, and this thing here with the orange parts is the adapter. So these adapters that we found, they are actually really good because you can move them in 3 different axes, and then you can take pictures really accurate. Really, it goes really well. Good. Perfect. Good. Oh, it's a pity that Iñaki could not join, but cool. Yes. So we have been explaining a lot about the AiScope, but we haven't spoken about diagnosis of malaria. So all you have been working in different techniques to fight against malaria. Like for example, if I'm not, we haven't spoken, for example, about one research that Pedro is conducting about HRP2 and HRP3 gens.
Mm-hmm.
That, if I'm not wrong, correct me please, because I mean, you all know that I'm an engineer, I'm not a doctor, and sometimes I make big mistakes about medical things. So that's the gene that it needs to be present for rapid tests to work,
Mm-hmm.
right?
Yeah. Mm-hmm.
So how does it work, this study that you're conducting?
Well, we have a new project in Equatorial Guinea because we found a deletion of the HRP2 gene in the continental region of Equatorial Guinea, and with 5% of the deletion, when you use RDT, there are 5 people that are not detected the infection of malaria. For that, we decided to start a new project to map the deletion in this part of the country and try to find hotspots of deletion and to try to increase the follow of the patient in this area of the country. It's a big problem because all people are using RDTs in endemic countries, and the problem are that the people are leaving the microscopy diagnosis and are using RDTs, and the problem is the increasing the deletion of the gene, and we can find a lot of people with parasite with this deletion. And we detected another problem, that sometimes you can see the gene, but the protein that is codified by this gene is different from the natural protein and can change the sensibility to the RDTs. I don't know if I'm explaining very good, but
Yeah, no, you have, definitely, definitely. Good, good. And actually, we have some people watching live this event. So I don't know if maybe they have any questions. If they comment on their respective platforms, we will receive the comments here, and we will be able to answer the questions. But also, I have a couple more questions for all of you, because you all have been people working in the field, working for many years, knowing the different realities and different approaches, that some of those approaches at some points maybe were a bit more controversial than others, and things like this. How do you see, like, that's an open question for everybody. How do you see the future of this, the future of the fight against malaria, and the future of diagnosis, and the future of bringing diagnosis to people? Is there anything that you see that it's going to be like the new trend and like the new path for all the countries to follow, or?
I don't know. Well, you say about the diagnosis.
Yeah, everything a bit, because at the end sometimes like, hey, hi Blenga, how are you?
Hello.
Good, thank you. How are you?
Good, good, nice to see you. So yeah, then let me introduce you briefly, Mulenga. So Mulenga is, if I'm not wrong, the chief, or almost the chief of the lab of the National Malaria Elimination Center, or at least somebody that I talk a lot and it's really important there. Could you maybe introduce yourself a bit better?
Hi, my name is Menga. I'm a lab scientist with PATH, senior lab scientist with PATH.
Good, good. Yeah, Mulenga has also been helping since the very beginning. Actually, I think even before than Rachel, because Rachel joined Path a bit later. But yeah, I'm happy to see you here. Maybe also, yeah, you also can answer this. So I was asking just generally open question of if anybody up here has any idea of the new paths that will follow the fight against malaria. Because, for example, if I'm not wrong, there's this technique which doesn't consist of diagnosis, just giving medication to people, that it's called, I forgot the name, but I know that Pedro, you know it because it's one paper has your name on it.
The mass drug administration.
What?
Mass drug administration.
Yeah, exactly. So, something like this, right? Like, or maybe has another name, Pedro. I don't know.
ACTs is the drug to against malaria. Is artemisinin? Are you speaking about that?
The truth right now, I don't know what I'm speaking about. I'm trying to find it while we talk about. So that's something that it's called. Give me 1 second, and I will get you the information. Yeah, here. It's called the seasonal malaria chemoprevention.
Okay, yeah. You're speaking about the prevention in pregnant women and child. Yeah,
Exactly.
there are two different chemoprevention. This with Fansidar or sulfadoxine pyrimethamine is in countries with stable malaria around the year, and another chemoprevention is with sulfadoxine pyrimethamine and amodiaquine in the Sahel. Is in the more seasonal malaria. The two strategies are very good to prevent malaria in pregnant women and child, and it's a good strategy because now the vaccine is not a real action, and these two action I think is the best path to follow the prevention in these two populations.
Why do you say that the vaccine is not a real action?
The vaccination of malaria is with RTSS, I think is the name of the malaria vaccine. And I think WHO are working to introduce the vaccine in some parts of Africa. In this moment, it's not a real vaccine because it's not a sterilized effect to prevent malaria, but have a very high prevention. I think it's in the 67 or 70% of the prevention or the
Okay,
protection.
good. I thought it was much less. I don't know why. I thought it was like something like 30 something or 40%. Okay, that's good.
Hmm.
I
Well,
have also heard that is a 30 or 40%, like Eduardo, not so high, like you said, Pedro, 60 or 70, no? I have heard 13 or 14, the protection of
I
this
think it's
vaccine.
higher. I think it's
Higher?
67 or something like that in child, because the vaccine is for child, is and for Plasmodium
Mm.
falciparum.
Okay, good, good. And then I wanted to ask something again, like, so we have people who is leading a master. Also, I'm pretty sure that Gemma, Pedro, and well, I mean even Rachel and Molenga has something to do with training of new people into this field. And what would you recommend? Like, why should people join this? What's what's the reason? Why should somebody who is listening right now and is at home thinking, okay, let's get into tropical diseases, not just malaria, because maybe people doesn't focus that much only into one thing. But why should I get into tropical diseases?
Well, I think the first thing that the people have to think to enjoy with the tropical medicine is to focus on help people. I think is the first thing that all the researchers are thinking, because malaria is the disease that receive a lot of money but produce a lot of disease deaths, and there are a lot of people that suffering this disease. For that, all the researcher have to think to focus on the people that are suffering this disease. If you enjoy the to help people and enjoy to research and enjoy to stay in Africa, for example, come on, you are welcome.
Yeah, and Mulenga, and I saw your face that you wanted to say something.
Well, so just like Pedro has said, so malaria and other tropical diseases mostly exist in the low to middle income countries. And so even if they like malaria receives a lot of money for support, unfortunately that money is not enough to be able
Mhm.
to be able to meet all the requirements and for the interventions to work. All the interventions are expensive, beginning with drugs and ending with diagnosis. Each and every intervention involved in malaria control is expensive. But there is not just malaria, there's also bilharzia, there's also uh, sleeping sickness. There are also these other diseases like that are caused by worms. They're also found in tropical countries. So some of them are actually neglected because malaria is sort of killing more people. And for these other diseases, people just live with them. They don't die as much, but the effects are still the same. They still reduce the quality of life for a person. If you have bilharzia for a very long time, it will cause obstruction in the stomach, including just worms. They'll cause obstructions and damage to your internal organs. So the more people join into working in tropical medicine or in tropical diseases, the more help we get, especially countries like Africa and other Asian countries that need this help. So the more people we have joining the fight against tropical diseases and malaria and other tropical diseases, the more we'll be able to reduce this burden and also improve the quality of life of people living in these geographies. That's what I think.
Yeah, no, also there's a
I'm
thing.
sorry.
Yeah, go ahead.
We cannot forget that, for example, COVID pandemic are producing increase in these diseases because all the government are focused on COVID, and some programs are don't have enough money to keep the control of malaria and another tropical diseases. For that, COVID is a high handicap for all people and for these countries. And I think in this moment, Europe, America, etc., have to give more help to Africa and other countries to control the tropical diseases.
Yeah, there was one thing that I was really surprised when I started with getting to know all you and all this, which is because like and maybe somebody who doesn't have a background of medicine could also feel themselves identified with this, and is that those diseases are easily curable normally. So, but you need to know that you have them. So, like for example, intestinal parasite, it's kind of easy to cure once you know it. Like malaria as well, there could be some cases of severe malaria or things that are a bit more difficult, but most of the times you just need to know that you have it, and then you take the drug, and then 1 week after, 10 days after, 2 days after, you're okay. Maybe there are things which are a bit more difficult, like tuberculosis, that if I'm not wrong, that you need to take drugs for 6 months, something like this. But otherwise, and that's a pity that people are dying for something that is treatable. And it's not like something that is magically new that nobody knows and this parasite doesn't have a cure. No, it's something that it's there. It's everywhere. You just need to know how to do it. And good. Ramon, I see you also nodding with your head.
Yeah, I totally agree with that. For example, there are also other tropical disease. For example, Chagas disease, where Spain is the second non-endemic country with a higher number of cases of this disease. It's also a neglected tropical disease. There are some common in all these diseases that many deaths could be prevented with better diagnosis. The big problem is that a lot of people, they don't know that they have this disease, and they don't receive the good treatment for that. For that reason, your project and AiScope is very necessary for improving the diagnosis in this disease.
We will hire you as a salesperson, Ramon, for AiScope. You're really good at sales. Good. Anybody has anything else to say?
Well,
No questions, nothing to discuss, because I think otherwise we might wrap it up here. I think that's good. We spoke a lot about malaria, what is currently being done. I also, for the people watching this, I do encourage you to follow those people on LinkedIn, and if you ever have the chance to meet them in person in a congress or somewhere, you will really be, I mean, not surprised, but you will really enjoy the time, because the level of knowledge about those diseases that you all have is just outstanding. And I'm always happy to every time that we talk or exchange mails or something, because like you have also a different perspective that we, the engineers, don't have. And I think that's also like looking at the future. That, and not only for malaria, for everything, we need to have this mix of ways of thinking between the high technologically really square-minded engineers like me and people related to medicine, and put them together, because that's something that I realized since a long time ago, that normally people that work in medicine, they have real problems to solve. That's why the papers are always interesting, but they never have enough time because they are really busy solving them, and there's too many problems. So that's why they end up using some old school technologies that maybe doesn't yield the result that could. I'm not talking about new techniques of diagnosis, but like, for example, my field, I work in AI, and I bring always everything to AI. And on the other hand, AI people like me, we have a lot of technology, but we don't really have real problems. So we end up using technology in banal things, random aleatory things that doesn't really bring any real good to the world. And I think this next and this bond and this union, it can bring a lot for the people.
Yeah.
I'm not just saying about AiScope or anything. I just say in general for any kind of project for the future. That's something that we need to start working more and more together, because I have been learning every single day from you all, every single second.
Eduardo, you are right, because I think it's the moment that all people are working together, technology, biology, medicine, and working in the same, to put the focus on the same diseases. Because, for example, in our case, our laboratory are working with mathematics in Barcelona, because the mathematics have the option to apply models to see what happened with the disease in the future. We can give the results of our research in HRP2 and 3 and prevalence of malaria, resistance, and these people can apply models to see what happened in the future, maybe in 10 years, 20 years, and can find a big vision of the disease. For that, I think is the moment that we are working all together, engineer and I don't know, but it's the moment that all people are working together.
Exactly. I'm happy to hear that we agree on this, because that's the thing. Everybody brings something on the table, and obviously not somebody can bring everything. And so obviously, I would never know as much as biology as none of you, and maybe it happens the other way around with computer science. So then, thank you very much, everybody, for joining. Thank you, the people who has been watching this event live, and that we will watch this event afterwards, because this event is recorded and we will just put it on YouTube. Okay, so everybody can in the future, the people who could not join today, they will be able to see what we spoke about, how interesting it is, how what everybody is doing in their respective fields. And again, I do encourage everybody to contact them. It's easy. The only is Rachel is Rachel Casado. So if somebody needs to find her somewhere in LinkedIn or something, really good microscopist and lab technician. Okay, then thank you, everybody. And and I hope we see us before then the next World Malaria Day.
Thanks, Eduardo, for your invitation.
Yeah, thank you so much for this moment.
Thank you very much.
Bye-bye.
Bye-bye.
Bye-bye. Nice to meet you. Bye-bye.
Bye.